Hi everyone, welcome back to my channel. In this video, we're going to talk about Yogish, my online clients in India. Yogish is a special client for me because when he contacted me, he was quite panicked about his injury because he was suffering from neck pain, shoulder pain, and lower back pain. When Yogish got his MRI scan, he was realized that he has multiple level cervical disc bulges and multiple level lumbar disc bulges. And they told him that he need to rest, do nothing, don't go to work, and basically literally no clue for his recovery. He tried multiple physios, chiropractor, spinal decompression table, and much more. But over the last 7 years, he was struggling with his recovery. When he contacted me 5 months ago, we start his plan, and in this video, he's going to share with you his experience with his recovery and where he is right now. We are going to start his gym routine in a couple of weeks' time because he's doing really well. And beside his symptoms has improved quite a lot, he has lost around 15 kg over the last 5 months. If you're suffering from chronic lower back pain or neck pain, one of the most important things that people getting wrong is they only focus on their MRI scan. And in this video, we're going to talk about many details, things about MRI scans, where you need to focus, diet, and much more that you can get much more clarity if you're suffering from chronic pain. I would highly suggest you to watch the video until the end. These videos are particularly designed for you to learn, educate yourself, and I believe this can help you a lot. I suppose today we're going to talk about your injury and recovery since we've been working, I suppose, now around 5 months now together.
Yeah.
And I would like to maybe you start with your own pace. How did you end up contacting me initially, and what was the injury? Maybe a little bit discuss about that and a little bit background about yourself. Like what you done before you contacted me, about your injury, and then we can go through more.
So yeah, I'll start my injury part, right? When this injury started. So this injury started maybe 7 years back when I was doing gym. And initially, it was just an year when I started the gym, and I was lifting. I was doing all the things I can do. And at that some point of time, I think so, I hurt myself. Not sure how it happened and why it happened, but slowly, gradually, the pain got increased, and then I started going. Means I was not able to walk properly. 7 years back, I'm doing that. So then I went to physiotherapist, and I have done, let's say, 2 months of physiotherapy at that point of time, which
Mm-hmm.
helped me. But there was a consistent pain when I used to drive, or when I used to do any kind of a sitting activity where my lower back is involved. So that started again after 3 years. I got major injury. I was not able to walk. Again, I went to physiotherapist. Again, the same journey started. Like I done physiotherapy for a month. Again, the same pain was there. It was not gone, but it has reduced. I was able to do some functional activity. Then after like again the 2 years, and this cycle goes on repeating again and again. I was tired. So I was thinking, instead of going to physiotherapist, let's go to someone else. So
I got you.
I went to orthopedic surgeon, and he suggested me not to do anything, not to exercise, nothing like that. Just do walking and medicines, right? So 3 months I have spent that, and he suggested, let's find a root cause for that, and let's go with the MRI. So
Okay,
I
and
went.
when did you see the? I suppose, like, I mean, you met the orthopedic, was the last person that you saw, like, as a like a kind of like a change, right, from physiotherapy to the
Yeah,
orthopedic,
even
because
after that, I went to some
yeah.
doctors. Right? Even after that, I went to some doctors. But first was the first big change for me was the MRI. Right?
Uh-huh.
When I got the MRI, I got that I got to know there are 3 disc bulges on my cervical, 2 disc bulges on my lower back. So that was kind of a shock for me because I am not from a medical background, right? So I do not
Of
know the
course.
proper terms, right? So
And
I
do
went
you
to
do you
him.
remember, Yogesh, when did you got that MRI scan? What was the time? When was the time of it? Like how many years ago you got that MRI scan?
Oh, it was 6 months back. Let's say it was six
S-
months back.
6 months back. Okay.
It was the latest
And
one. Yeah.
and after the MRI scan, who did you see? Literally.
So I went to that doctor back. I went to the doctor, and he just verified my MRI, and he told me that avoid all the activities. don't drive bike,
Mm.
don't do a lot of sitting, wear the belts that on the cervical and the lower back while traveling if you want to travel. Let's do more of a means if you're not working means physiotherapy is not working for you, let's
Yeah.
suggest to neurosurgeon. So from
Uh-huh.
where I went to neurosurgeon, and neurosurgeon also suggested that let's stick to the physiotherapy right now and let's not go to the any kind of drastic changes right now. But again I went to physiotherapy after that.
Okay,
Again for a
let's go a
month.
little bit slower. You're going very fast. Let's go a little
Yeah.
bit slower. Then the person that you saw, the neurosurgeon, I suppose, the person who explained your MRI scan suggested you to don't do anything and rest and wear belt basically. But
Yeah.
in that time, you weren't seeing any physio. You didn't have any routine of exercises as such. You be
No.
basically resting. And where you were working in that time, Yogesh?
Yeah, I was working. I was IT professional, so I was working continuously. So I have to work
Uh-huh.
or my bread and butter. So that was the case. But I was very much afraid to sit at that point of time. Should I sit? Should I drive? Or should I do any kind of a test? So I was very anxious about it, and I was
I
having a lot
got
of
you.
attacks, right, because of that.
I got
Because
you.
he told a lot of things that were not positive for me at that point of time.
Mm-hmm. Got you.
Yeah,
Okay. And then what did you do after that? He suggested to go to the neurosurgeon, is it?
yeah, neurosurgeon. So
And how
neurosurgeon.
that did go? Yeah.
So neurosurgeon also suggested one few tests, right, for vitamin D, B12. They suggested me that, right?
Mm-hmm.
So that was the point, and it was low. Definitely, it was low, right?
Got you.
And he suggested some medicines and some basic physiotherapy exercises. Maybe he was saying that to walk fast, try to walk fast,
Walk
but
fast.
fast, yeah.
Got
But
you.
that was not helping me. That was actually increasing my pain at that point of time.
Mm-hmm.
Some also he also suggested to do swim. I also tried the swimming part, but again the swimming was also causing a lot of neck pain. Right?
Swimming, basically, just
Yeah,
kind of like a random exercises, like basically more
exactly,
aerobic. Yeah. And to
exactly.
just describe for people who listening now, what was your pain like? Like, what was your symptoms in that stage? Like, can you describe your pain? Like, what type of
So
pain did you
yeah,
have?
I was not able to sit for let's say more than 30, 24 or 30 or 14 minutes. So if I sit, I was having a lot of back pain. I used to lie down after that, and I was not able to go office. I was not able to travel at all. Right?
Got
It
you.
was manageable. It was manageable. I can manage it. I can bear it. But again, it was very bothering one. Right?
Which
So
means it
if
was
I
consistent. It was pretty
exactly, this was
consistent.
consistent. Yeah, if I go to the scale, right, to know the audience, right, what was the scale from 1 to 10, 1 being best and 10 being worst. So I was having around 7, both
Seven pain.
back, yeah, back,
Mm-hmm.
neck, and the lower back, right.
Okay.
So that I tried that as well, and also parallelly I was doing physiotherapy, chiropractor
Mm-hmm.
physiotherapy. Let's have done all
And do
the
you
events.
mind if I know what was the physical physiotherapy or chiropractor that was involved with what they were giving you and what they were doing for your recovery?
So they were using some electrical part as well as chiropractic. They were also giving some exercises. Needling was also done. Cupping was done, right?
Mm-hmm.
So and then there was a what is that called, which pulls your body, right? Traction.
Decompression. Yeah,
Yeah,
decompression. Yeah, table.
decompression
Okay.
machine. We have tried that as well for neck and lower back both.
How many
It
sessions did you do that?
let's say
You
20,
remember? 20.
20,
Yeah.
20 sessions, right? 20
And how
sessions.
did you
So
find that?
it was helpful, but again, I was going into same cycle where I do some physiotherapy, it improves, and then again it goes
Uh-huh.
back. That was very bothering for me, and I was thinking, is it my life, right? Going to same cycle again and again, again and again.
I
I
got
need
you.
to get out of it.
Mm-hmm. And did you
So
ever
they,
ask them why this is coming back? Did you just consult them and say, listen, this has happened before with me. It's getting better a little bit, and then it's going to come back if I do something. What they suggest you? Did you ask them this?
yeah, I have asked them. I have asked them. So they told me maybe because of your lifestyle, you have a lot of sitting job, right? And maybe you are not doing right amount of exercises or light way of
Mm-hmm.
exercises. So that is causing you this issue again and again.
Got
But
you.
I was not very much convinced about it. So how can I improve that, right? How can I do right
Mm-hmm.
amount of exercises and
Yeah,
right weight of exercises, right? So they gave me some set of exercises that were beneficial, but it was not that much challenging. Right? I was doing same exercise every day, and there was no such plan. And I wanted some exact plan where I can challenge myself and go back to the gym and I can maintain that lifestyle, right? I just wanted to
of
get out of
course.
this whole cycle
I
because I
can
have
understand.
gone through this cycle from let's say 4 or 5 times. Now I was tired of this.
Hmm. And when you sorry, I cut here. I just want to know what was your impression of your injury after you saw your MRI scan? Because I think that was a big point of like, your injury, that when you saw you have actually disc bulges, or like how they explained that to you. Did they explain that to you properly? What's going
They
on there?
they did not explain me, means I was trying to ask why this budget has happened, right?
Hmm.
That too in five places. Why? What was the cause of this, right? So I was not getting any proper answer, to be honest. I was getting answer, but that was not very convincing for me, right?
I got you. I
Yeah,
got you.
yeah. They are all saying the same kind of stuff, right? Muscle weakness, maybe posture incorrection, and all those things, right?
Hmm.
And yeah, they are just saying that avoid this, avoid that, avoid this. But what can I do then? How
I
can I
can
do? And
understand.
yeah, some people also suggested me, right, to change my career from IT to some other profession, and that is not possible for me. That is
That's
my
a tough one, man.
that is a tough one, right? And I
Yeah,
like what I do, right? I like what I do. I like to do coding and all those stuff. So I cannot
of
change my
course.
career immediately once I get some injury.
Yeah, of course. I mean, the thing is that, they don't give you solution. They just ask you to change career, but
Exactly,
that's not doesn't mean necessarily you're not going to be having any pain in your new career, right? Which
exactly,
means
exactly.
you could still be in pain. All right, then what happened after that, Yogesh?
So yeah, so I would say the last physiotherapy session was good. Okay, they helped me, but I still wanted. I was looking for a permanent solution, right? So
Mm-hmm.
they helped me. They told me that you can sit. That is not an issue because I was after seeing an MRI. I was
Mm-hmm.
very panic about my posture. Should I sit? Should I stand? Or am I hurting my disc? Or am I hurting my spine? Right. I was very much
Of
anxious and
course.
let's say
Mm-hmm.
afraid of doing all the activities. Right. I was
Of
stuck
course.
in my room. I was stuck in my room. I was not talking to anyone. Right. I was not doing any kind of activity. I was just sitting, doing my work and sleeping. Not also eating at that point of time.
Yeah, it was
So
quite, I suppose, like not just only physically debilitating, but mentally you weren't in a good place either, right?
exactly. Exactly. Although that was not a big deal, but still mentally, I think I am too much, let's say, yeah, anxious about it.
Isolated. I suppose you felt like isolated because you weren't able to go out, meet your friends, have
Exactly,
have any type of hobbies or etc. Right?
exactly. I was afraid. Is it a right thing to do? Walking is the right thing to do. Sitting is the right thing to do, right?
Exactly.
Yeah.
Okay. Then what happened after that, Yudish?
So let's say I was searching for the people in the YouTube, right, who had such kind of injury, who had such kind of
Hmm.
situation, and I came across one of your client, that is Monish.
Yeah,
Yeah. So he was making his video, and he was saying that he was feeling his situation, which is much worse than mine right now,
I got
right
you.
at this point of time.
Yeah.
So then I googled you, I YouTube you, right? Then I was seeing your YouTube videos. So I was thinking, okay, I have given a lot of people. I have contacted almost 12 to 13 doctors right now. So let's consult you as well.
Which
And
means
it was
before you
very
consulted me, you met 12 different people, which
exactly.
is
I met 12 different people. So
okay.
again, after that, I was very hesitant about it, first of all, right? Online consultation. I have never had an online consultation,
Yeah,
especially related to physiotherapy and all those things, right?
of
So, and
course.
yeah, and plus you are not in the same country, you are in a different country.
100%. Yeah.
Yeah. I
It's a
cannot
lot
meet.
of,
Yeah.
I suppose, what is it? Confliction comes to your head that, okay, whether this is going to help me or not. But finally, you managed to book a consultation, and I suppose my question would be like, how did you find the initial consultation?
So initial consultation was very detailed one, right? Before having consultation, we had one form where we have to submit the MRI, all the reports we had, right?
Yeah.
Which area of pain I had, right? So I was trying to analyze which area of pain I had. So I was like circling every part of my body. So
Yeah.
initially, yeah, I told her that I'm having knee pain, I'm having the joint pain, I'm having neck pain, and jaw pain, everything. Right? I was like, okay,
Of
what can I do?
course.
And you were like, let's take one by one. Let's take everything. We'll work on everything right now, but let's focus on the key thing right now. So initial consultation was very much detailed. Like no one in my whole consultation means let's say journey has asked me what is a whole day of routine, what you're doing in your whole day, how is your
Absolutely.
lifestyle, right? What kind of activities you do, right? How much you sleep, how much stress you have right now, what kind of job you do, right? and what kind of things you eat. All those things has been asked in the first consultation, which was very impressive for me because no one has asked me that much details. And you explain me each and every terms of the MRI, right? Whatever the terms were there, we have gone through that MRI. So that gave me the initial level of confidence, right? And I remember that I have pinned you, I think so 20, 30 questions as well in the email. And you replied one by one everything. So
Absolutely.
that gave me the initial level of confidence, and then we started our journey.
Exactly. Now, like I suppose one of the things that it's like very important for people that like got contacted me recently. So many people think, okay, that we are only focusing on the injury as a fact, which means like literally if you have a back pain, and let's say somebody has a shoulder pain or neck pain, we're just
Yeah,
gonna focus about their back pain, which is
yeah,
not what we do. The plan is a kind of like a bit of a full body,
yes, exactly.
rehabilitation, which means when I'm saying rehabilitation, these are exercises that we use and
Exactly.
gradually build up and get you basically and find out what helps you to gradually build you up and give you some more, I suppose, functionality in your day-to-day activities.
True.
And I suppose my simplest way to answer this question is that if you have a shoulder pain and neck pain and lower back pain, it does not mean that you need to get three different type of programs. It's the same program that you follow, but you
Yes.
basically focus on those area as well
Yeah,
alongside your main issue. Like let's say, but for you, your neck and I think your shoulder and your lower back was quite
major issue.
a,
Yeah,
a, a big deal, right?
yeah.
Okay, then when we start your plan, maybe just describe for people like how was your approach or how was your experience with the plan? Like because there's a lot of question comes along with okay, what's this plan look like? Can I follow the plan? Some of my patients are very worried that I'm very weak. I can't do anything. I'm not able to do anything. I'm in bed. Can I follow this plan? How intense is this plan? Maybe just give them some insight like that.
So, right, each plan has a different, means it's customized plan. Every individual will have a different plan based on their injury, based on their weaknesses or strengths, right? So, yeah, in each, initially the exercises are very simple. It's not that you are jumping and lifting 20 kgs of dumbbells, right? It's not that.
Exactly.
Initially, it's very simple, basic exercises where we are having mobility exercise twice a day and strengthening exercise thrice a week, right? So, it's a very well planned, well mannered plan we have, and we also have some trackers, the stress tracker, the sleep tracker, the pain tracker, right? Everything is being observed by the box, and you can have the box access 24/7. You can ping them if you have certain kind of pain, right? Initially some exercises were causing me some of the concerns, right? And
Yes.
I immediately ping, okay, this exercise is causing me a pain, and you were like, these exercises are very basic exercise, it will not cause any issue to your spine or your discs. So you can continue doing it, and if you face the same similar kind of issue further after doing maybe 1 week or 2 weeks, then we can change it in the next session. That's for sure.
Absolutely.
Yeah.
Absolutely.
So it's very catered program and very well managed program. So it's not constrained that you can do it or not, but you have to be disciplined and you have to give some time, right? You have to be
Thank you.
consistent about it. So if you don't be consistent and if you are just doing for initially and then you're forgetting about it, then it will not work because it's a very slow process and it takes time, it takes patience, right? So yeah.
100%. 100%. You mentioned a few things that is very important that I re-emphasize. One is that the exercises are very basic, which means you can definitely do them
Yeah.
in any level of, I suppose, strength you have. The second thing is that when you start the routine, not everything is going to be perfect. Does that make sense? Which means
Exactly, exactly.
Bob doesn't have a magical cure for your issue. There's no
Exactly.
shortcut or there's no fast, quick fix method here. It's all based on time, which means we track data over the sheet that you're getting, the program that you're getting, and that I think program he usually give you independency to
Exactly.
understand and get involved with the plan to know what helps me and what doesn't, which means you not just follow the plan blankly and say, okay, am I getting better or not? You can see the data changes over the course of,
Exactly.
let's say, 4 or 5 months. And that I think is hugely encouraging, right? because
So that's what, and it's step-by-step plan, right? Each week we will have more challenges. Each session you will have more challenges. It's not a consistent plan. We will have one set of exercise throughout the whole 20 weeks. It's not like that. You will be there will be a lot of changes based on the feedback you give to the work. Right? Every 2 weeks we have consultation, and based on that we discuss about the pain which we had after doing the exercises and after doing the whole day of your routine. Right? So that is very helpful.
absolutely, absolutely. Okay, then, Yogesh, maybe just while you're talking about the plan, discuss about like when you follow the plan, is it easy for you to follow it? Like in regards to, like, I know you work in IT, but how much skill of IT you need about to be able to follow the plan?
It's a very basic, simple exercise that you have the YouTube links and all those things, and you have to send the videos to the Bob, right? And he will correct you if you are doing anything wrong. So it's easy to follow, right? You just have to give some time, not very huge amount of time, right? I'm not saying about you have to give 3-4 hours of time, but you have to
Yes,
give some time because you have to improve, right? You have to improve yourself. You have to work on yourself, and it's not a magic, as you said, it's not a magic pill that if you eat one magic pill and everything
100%.
is sorted out, right? So yeah, you have to give some time, but not that huge amount of time, and it's very easy to follow your routine. It's a home routine
Brilliant.
initially and very easily to do it.
Thanks for that. But now, if I like we move on forward through, like, let's say you've done halfway through the first 20 weeks, and
Yeah,
what was your overall experience in regards to following the plan? Like literally, because not everything changes very quick, Yogesh, right?
correct.
Like in your own way, maybe explain for people, like, what was your experience as you were following the plan, and right now you've done 20 weeks with me, and maybe just give them some feedback. How was the journey so far?
So let's go ahead, right? Let's start with initial few weeks. Initial few weeks are very basic, right? And we'll have some assessment that are you able to follow those exercises, right? A certain set of intensity. Are you able to follow it? So once you are able to follow it, you have to challenge your body to get more strength. And we'll have more set of challenges, right? So we'll have more challenging exercise. And if in terms of following it, right, it's very easy. It's not very difficult to do it. Just you have to be disciplined and give a little bit of time to follow them. So following the plan is not very difficult. You have to be consistent. That's it.
I get you. And then in regards to progressing that, like, I suppose, maybe tell people about how your symptoms kind of like improve over time, like since we start your plan, and what did you find was helpful, I suppose, through these 20 weeks for you, while you were following the plan. What did you kind of like find that really did help you?
So when once we started following the plan, right, we are more active than the previous, right? I was not active after, let's say, before starting the sessions, right? And I become more active. I have started walking more. I have started doing exercises and mobility exercises. So you have to do mobility exercise twice a week, twice a day, right? So that helped me a lot. That helped me a lot. So at that point of time, I was very active. I was
Hmm.
walking as well. I was doing mobility exercises and strengthening as well, right? So let's say in terms of strength, I was not able to do push-ups. Now I'm able to do push-ups very easily, right? I was not able to do mountain climber initially. It was painful, and now I'm able to do it. So gradually, slowly, you're improving your strength, and with strength increasing and with the mobility increasing, the pain goes down slowly. It's not immediately it will happen. It will happen slowly, and not every day the same day, right? So someday
Of
you will have
course.
some pain. Yeah, someday you will not have pain at all. So it's slow process. It takes some time. You just have to believe the process. That's it.
Absolutely, absolutely. And in regards to kind of like your initial injury, Yogesh, like what are your symptoms right now in regards to your back and your neck and your shoulder? Because I know we still haven't kind of got you to. I mean, we're starting your gym routine right now gradually. That's your new
Yes.
phase of your rehab.
Yes.
How did you find your symptoms changes over the last 20 weeks?
So I'll say the lower back huge improvement. So almost 7 to 80% no back pain at all, lower back pain at all. So I'm able to drive. I went for some road trip that was almost I drive almost 6 to 7 hours right continuously. So in terms of that, yeah, definitely lower back has been improved a lot, and I'm very happy with the results. The shoulder and neck we are still working. I think so. Still, I'll say the 50 to 60% has been improved, and we are still working on that 40%. But yeah, it's it has improved a lot, and I'm more functional right now. I'm able to do things more confidently.
Exactly.
So
Yeah.
exactly,
Which means one of the I think things that was in your mind that from the first day that you start your plan was that okay, I've seen so many physio, I got treatment and I got a little bit better, and then I've been back to the first square as soon as I
exactly,
start to do more. Now, one of the things that we are doing in your plan that we are gradually challenging you to do those things that used to be challenging for you before, like squatting, deadlifting, and lifting and twisting. And I think the biggest things that I think people with chronic lower back pain, which is your case, you know what I mean, and
yeah,
pain in chronic pain is that the fear of, I'm going to damage something and I'm going to get hurt again.
exactly,
Which
exactly,
means
exactly,
maybe just explain in that perspective how this plan helped you to get where you are right now, because confidence and doesn't change by taking tablets or resting.
exactly. Yes. So I'll tell you that there are two aspects of chronic pain, right? One is mental aspect and one is the physical aspect, right? So we also work on a mental aspect where you told me to be more socialized, right? To interact with your friends, to interact with your family. So that also helped me to distract my mind out of the pain. That is one very important aspect, right? The stress is the second aspect. The sleep is another aspect which comes through your mind, right? Everything is your mind. And then the physical aspect, let's say we are doing activities, right? So more activities and doing more of the, let's say, all the strength exercises and the mobility exercises helped me to have those kind of functional things. And slowly I was stretching more my body, right? I was stretching my body a lot. I was sitting for some time, right, for doing my work and desk job, all those things. And I was not afraid to do that right now. So
Exactly.
that mental aspect helped me a lot, right? And when I was pushing myself, slowly I was seeing that I'm also gradually improving my pain, right? I was improving my pain since I'm pushing myself. I'm driving more bike. I'm trying to sit a lot, right? So that helped me and
Absolutely.
that gave me confidence. And in terms of that, right, that's how the chronic pain got reduced slowly by having
Spot
more
on.
confidence in your body.
100%. Because like the reality of the pain is that the pain is not always related to tissue damage, or we don't only
Exactly.
analyze your MRI scan and say, okay, these are the source of pain that you see in your neck and your lumbar spine because you have
Exactly.
bulges. And I think on an initial consultation, I clearly explained to you that how common are these changes in MRI scans.
True.
Like you literally see those changes in almost everybody, anyone from age of 20, sometimes even earlier, if they go get an MRI scan, have some sort of changes, degenerative changes, bulges, herniation, stenosis. All these terms are quite common, you know what I mean, for people, and they
Exactly.
don't really aware of that until they get injured, and then they end up getting an MRI scan, and then
Yeah.
the immediate response to those results is that okay, here is the source of your pain and this is how we're going to fix it, which is completely
Yeah.
wrong,
Exactly.
because
Yeah.
these changes can happen to anybody in any time in any age literally. And what
Exactly.
we have even as data that we know by now that these changes does not always correlate with pain. Like there's 80% of, like, let's say, what is it? I would call it population of people. Like there are 80% of people who are out there who has bulges, herniation, and they do not have any symptoms. Now, this particular study, I think I explained this to you for you initially. They have studied 3,000 people, and these
Yeah.
3,000 population are asymptomatic, which means they don't have any pain or any I suppose complaint, and they just put them on their MRI, and up to 80% of that 3,000 has degenerative changes, bulges, herniation, and much more abnormality in their spine without any symptoms, which
True.
means it's quite a big claim to make if you see somebody with an MRI scan and
Exactly.
tell them, listen, this is the first thing that you have to fix it. But I think
Exactly.
you mentioned about this that I think your MRI scan caused a lot of fear for you
Exactly.
because
Definitely.
they told you, okay, you have bulges in the neck, bulges in your lumbar spine. Maybe explain people how was that, like, that experience for you to go through that.
So let's say I got an MRI. Immediately after that, I was searching everything on Google, right? I was YouTubing everything,
Mm,
right? And then
Yes.
on top of that, doctors gave me some positive as well, some negative aspect of it, right? And after that, immediately I got panicked, right? I stopped my all the functional activity which I was doing earlier, right?
No, no.
So that getting over information after means let's not Google it everything, right? So getting that over information, feeding over information to a brain, right, also cause lots of anxiety and panic attacks, which
Absolutely.
increases our pain, which increases our fear, right? So that's why I
Thank
told you
you.
that there's a mental aspect of the chronic pain, right?
100%.
Or any kind of pain that you have
Yeah.
it.
Which means
Yeah. So
catastrophizing your pain based on your
exactly,
information that you have and the MRI
exactly,
scan. Yep.
exactly. So in Google, right, if you search anything, let's say but this, but you can get a normal thing, right? You can just apply it back to the cancer as well. So
Yeah.
you
Of
will
course.
get each and everything, but that is
Absolutely.
not
Yeah.
everything, right?
I
That
think
totally
I think
depends.
we discussed about a couple of things initially that I think it would be beneficial for people. We discussed about it today. I did
Yeah,
mention I'm confident that I told you as well that stop reading about
exactly, exactly,
anything that is related to
exactly.
your injuries because by reading more the difficulty of surfing on
You
internet
start
and
more
YouTube,
thinking about it. Yeah, yeah. You start thinking about it
you're
continuously,
more
24/7.
focused
Yeah,
on it, and plus the information that you get is not necessarily filtered through any type of, I suppose, correction that how valid and how relevant these informations are to your injury. And you
exactly,
start to get more overwhelmed, more fear, more panic, and that
exactly.
hugely impact your anxiety, your sleep, your trust about your body, and much more. I think
Yeah,
that was
yeah,
the
yeah,
first thing. There was
yeah.
another thing that I wanted to bring up as well, Yogesh, which was really, I think, a big opening, I suppose, a page for you in your recovery was that initially you were hugely involved with stretching your neck, your
Yeah,
shoulder,
exactly.
and try to adjusting it
Yeah, yeah.
because I suppose we discussed about this. You have like a hypermobility that
Correct.
you're quite aware of every part of your body, and is a condition that is quite hereditary, and a lot of people has it without knowing it,
Yeah.
and you weren't aware of it initially,
Yes, yes. I
and we
wasn't.
discussed about it that how common it is and what are the symptoms that people has with hypermobility and what are the typical ticks that they have, is like a basic addiction on adjusting themselves, stretching their
Yeah.
neck.
Stretching the neck, stretching the
Maybe
back,
discuss
right?
with people a little bit about that, like how was that, Yogesh, when I discuss
So
about it. Yeah.
yeah, yeah. Initially, right, whenever I used to have pain, I just used to stretch my neck, back, lower back. I used to twist right myself and all those
Yeah.
things. And then Bob told me that you are not doing this as a right. Means it's not the right thing to do every time. Every few minutes you cannot do this, right? And I'm already a lot
Absolutely.
stretchable, right? I'm already a lot mobile compared to the other people because of my hypermobility.
Absolutely.
Exactly,
Absolutely.
exactly. And I'm making the things worse. So I shouldn't be doing that, right? Immediately, means it takes some time, right? It's a habit. It takes some time, right? Immediately, next day you will cannot reduce it to zero. But slowly, gradually, that also helped me a lot. So I was not stretching only the mobility exercise which Bob was giving. I was doing just performing that here
Yeah.
and then one or two times. That it's not that I'm not doing it all, but once or twice in a day, that is fine. I'm doing it, but that's it. I'm not
Exactly.
every few minutes. I'm not moving my neck or
Yeah.
shoulder on this,
I
right?
know,
So
and
that helps.
it's a quite a difficult thing to do because you grow with it. You know what I mean? Which means it
Exactly,
become part of
exactly,
your habit of your day-to-day activity, and you are constantly adjusting yourself, your back, your hip.
exactly,
I
exactly.
typically see a lot of patients with hypermobility in my own clinic, and generally speaking, it's a lack of awareness in public for what is hypermobility is, what you need to do first about it. And most of my patient who has hypermobility, either they're attending yoga classes or Pilates classes, which I'm not trying to demonize those two
Yeah,
activity,
yeah,
but they're quite, against of what they should do, because they're quite
exactly.
mobile anyway. But
Yeah,
the injury, I mean, it's not an injury, is a condition that they have. It bring them to do more stretches because it feels good when you stretch.
yeah,
It feels good when you adjust yourself, and unfortunately become addiction that they have it all day every day, and they
exactly,
keep doing it. And if they're not aware of it and they're not replacing that to something else, it become like a vicious cycle because the more you stretch and more adjust, you feel more
exactly,
symptoms over time and more
exactly.
need of adjusting. It's like basically a loop, if that makes
Yeah,
sense.
yeah.
Okay,
that's what you told me to focus on the strengthening part rather than the mobility part, right? So that strengthening
absolutely.
helped me a lot, right? So I am not doing that right now. I am just
I know.
sitting.
I'm delighted, man, because I mean, I see a huge amount of improvement, not just on your symptoms. And one thing that I really wanted to emphasize, overemphasize with people here is that if you're suffering from chronic pain, okay, in your
Yeah,
lower back, your neck, your shoulder, any part of your body, okay, if you're focusing on improving just your symptoms, you're on a wrong plan. As simple as that. You
yes,
have to focus on functionality, which means what are your hobbies that you like to do? How can I
yeah,
get there? What is the plan for me to get from here today that I can't, let's say, do 10-kilometer walk to get to that level that I want to be?
exactly,
Or
exactly,
if your goal is to be able to go for a road trip, how can I get to that level?
exactly,
Not just focusing on symptoms is hugely beneficial because if you're just focusing on symptoms, you're never going to be satisfied and confident. I'm able to do that. Does that make
absolutely,
sense?
yeah,
and
absolutely,
and I think that was a huge turning point for you because you're totally a different person, man. You know what I mean? Like
yeah,
in the initial consultation, I can simply say that you were very like stressed. You had so much anxiety about yourself and your
anxiety,
body,
panic,
and a little bit of kind of lack of trust about anything because you've seen
right,
12, 13 people before me, and
yeah,
we're not trying to say they didn't do the job or they didn't help you, but every person has a different approach. But
definitely,
like pain and chronic pain is quite a common thing that people suffer. And unfortunately, if your practitioner is not familiar with the chronic pain, they might not be able to help you. You know what I mean? And they might just suggest you pain management method, which is just happen in a very acute phase of your injury and is not really applicable if you are having a chronic pain. If you keep following a acute pain management, it is wrong and it's not going to get you anywhere. And that was
definitely,
the issue. You
definitely,
keep
yeah,
getting injured and feeling I'm not actually improving and going back to physio again, etc. Um, Yogesh, that I don't want to. I can talk forever about this, because I'm very excited
that's
with your
fine.
progress, man. You've done really
Yeah.
well. Okay, this is one of the questions that I wanted to ask all of my patients now. Usually, if you were going to give people three, four, five tips, okay, in regards to what you find helpful in regards to your rehab or your recovery, beyond what we do, beyond what we do actually,
Yeah,
um,
yeah.
maybe just share with them what is those four or five things, as in your own language.
So first would be the stress management, right? The mental aspect. You have to manage that. You don't have to think continuously about the pain and the issues you're having in your body, right? You have other things as well to try to focus on that, and rather than focusing on the just the pain part, right? That's the bad part of your life. So focus on a good part of the life, right? That is a major thing that I have seen and that I am applying right now. Second aspect would be a food, right? Right amount of
Hmm.
environment to provide to improve or to
Diet,
improve in your
basically.
routine, right? So you provided the right amount of exercise or supplements, right? What supplements I have to eat, what food I have to eat, right? How much
Yes.
protein is important for your body, right? So that one thing helped me a lot. So that is the second aspect of it. Try to be as active as possible, right? That is the third part, right?
Excellent.
Even if you're following any exercises or not following any exercise, try to be active, try to move your body around, right? Walk,
Hmm.
run, or do whatever you can, what you like, right? That is a major aspect of it. And try to have some hobbies that help, right? Try to have some hobbies. That is
Amazing.
another aspect. Right? Because of that, you get distracted and you focus on the hobby more rather than the pain. That is already the first aspect, but still try to have some hobbies. And fifth part is, let's say, try to challenge your body, right? Try to challenge your body.
Good man.
And it's-
Good man.
yeah,
I
yeah,
like that. I
that is
like that.
it.
Yeah,
Yeah.
definitely. Don't give up, and you can definitely get where you want. I suppose like in regards to like what we doing, you guys, if you were going to do this plan again, yeah,
Mhm.
would you do it again?
Definitely, definitely. I
Yeah,
would do it
because
100 times if it's improving my life, right? So that's fine.
absolutely. Yeah.
Yeah,
I mean, like, because a lot of people are like, discussing about, okay, how much I can trust this plan, how much I can invest on my plan, like to follow
yeah,
what Bob's telling you. And
yeah.
I try to literally ask this question from my patient, and rather than me answering their question, I want to ask you that Did you find this, I suppose, investment that you're making for yourself was worth to do it? You know,
Exactly, it is worth it. It is worth it that I have improved in my symptoms. I have improved my strength. I have improved in terms of my weight wise. That weight I have reduced my
I
weight from
know.
94 to 78. Right?
I
That
know
is a
we didn't discuss about that. There's a lot
yeah,
of things to do. Maybe just to finish this call, just maybe just share with them where you're at in on the weight wise, because initially we discussed about your diet hugely,
yeah,
and that's another
exactly,
aspect of the whole plan that we cover, I suppose, and it's quite holistic to know what you're eating and how much that can impact your recovery. What was your
exactly.
weight initially, Monish, when we start you?
So it was 94. Initially, it was 94. So when we started, let's just before we started, it was around 94, 96. It was fluctuating between that.
Yeah.
And slowly, you gave me diet, you gave me supplements, right? And I was very mindful about the eating, what I'm eating right now, how much protein it
Yes.
has, how much carbs and fat it has. So I'm
Yes.
eating everything. It's not that I'm restricting myself to not to eat sweets or not to eat any kind of things.
Yes.
Just I'm being mindful about it because we have to sustain it, right? At the end of the day, we have to
Amazing.
sustain it. It's not that 6 months of eating and then again we can go back to normal.
Of
It's not
course,
like
you
that.
learn actually how to manage your diet,
Exactly, exactly.
what you have to do, and what's
Yeah.
your weight right now, Monish?
Right now it's
Yogesh.
Yogish, yeah.
Yeah.
It's 78 right now. It's 78. It's
Wow.
shooting to 78, 79. So almost 15 to 16 kgs I have lost just because of
Wow.
the home routine which we are following and the food which we are having.
That's
That's the truth.
amazing, man. That's
Yeah.
amazing. Because generally, 94, you were quite heavy, which means you needed to lose weight actually.
Yeah, exactly.
And that's another thing that can hugely help with, I suppose, like I mentioned on my previous video about high BMI, is associated with lower back pain. You get me? Which
Exactly.
means you carry just extra weight, and that hugely impact other things, including your back as well. But
Exactly.
that's amazing, man. That's amazing, and I'm really delighted with your progress. We are moving on towards the gym. We're starting a new routine, which is you're gonna start going to the gym, get back to what you love to do. I think that was
Exactly.
one of the things that you wanted to really know.
Yeah, my
Can I
initial goal.
actually go back to the gym and train in the gym? And we're gonna get you back. Again, everything is a structure. You have a plan to follow. You don't try and error things, and you have a coach that you can get access to it.
Exactly, exactly. That's one the most beneficial part of this whole routine, right? You can consult, you can ask what questions you have, and you will get a right amount of guidance. That's the most important thing.
Thanks, Yogesh. Yogesh, is there anything else that you'd like to share with people? Because I think we discussed quite a lot. I can talk forever, but is there anything else that we missed, and you'd like to share with people?
So trusting your body, right? That is the most important thing. I think so. We did not miss that, but I'm still highlighting it again. Trusting
Of
your body,
course.
right? Trusting your body. Be mindful of eating and enjoy your life, right? So that's the only thing
Absolutely,
I want to share.
absolutely, and I just want to just add on to that that I think you're definitely right, because the reality is that your body has a ability to repair and heal if
Exactly.
you give your body a right environment and have a plan to follow. Because if you have a plan, you do always better. Without plan,
Exactly.
you all over the place. Random things, a lot of research, and no clarity
Exactly.
and answer. That's so important.
Definitely.
You guys, thanks again for your time, man. It's been a
Thank
pleasure
you.
working with you. We're gonna share more video with people that you're training in the gym and show them
Definitely.
some serious gains, man.
Definitely.
Amazing.
We are doing it.
Thanks
Yes.
again, man. Cheers.
Thank you.
I hope you guys find this video helpful. If you have any question regarding your injury, you can always leave me comments. If you need further assistance, you can always book an online consultation with the link below, and we can get you started right away and go through your case, analyze what is your injury, and I can give you some feedback. What would be the road of recovery for you? I believe you have tried many things before. If you would like to see more testimonial, I would like to share with you a link here that you can see more of my patient testimonial videos that you can learn, understand what we do. And if you think this is something that you would be interested, we can get started right away. Before we finish, if you find this video helpful, press that like button, share this video with your friend and family. And if you would like to do me a huge favor, please subscribe my channel for my weekly update. Until next week, all the best.